World Mental Health Day. Mental health in an unequal world.
Together we can.
World Mental Health Day is an international day for global mental health education, awareness and advocacy against the social stigma. It was first celebrated in 1992 at the initiative of the World Federation for Mental Health, a global mental health organization with members in more than 150 countries. On this day, thousands of supporters come to celebrate this annual awareness program to bring attention to mental health illnesses and its major effects on people's life worldwide. The theme for this year is Mental Health in an Unequal World.
Stress and anxiety. Many of us, we have stress and anxiety, we experience it almost every day in our lives. But when the stress and anxiety becomes intensive, excessive, and persistent, then that causes concern. A feeling of fear, of worrying all the time, and feeling uneasy, this would also cause concern. Now, anxiety can be very normal in certain stressful situations like examinations, taking a test, or public speaking, or going for a job interview. But when this anxiety becomes too excessive and it consumes and interferes with our everyday life, then it becomes a problem. Now, the feeling of being stressed can be triggered by any event, like I have explained just now, that can make us feel frustrated or nervous. Now, stress and anxiety can produce both physical and psychological symptoms. Now, stomach ache, muscle tension, headache, dizziness, frequent urination, change of appetite, trouble sleeping, diarrhea, sweating, shaking, fast heartbeat, fatigue, all these can be symptoms of anxiety and stress. And these also cause mental and emotional symptoms in addition to physical ones. How do we deal with stress and anxiety? The best is to always talk to someone. Talk to a professional who can help you to understand stress and anxiety, who can help you to de-stress.
The pandemic has taken a toll on the mental health of youths, where they are feeling isolated from families, schools, or colleges and community. There's been a rise of anxiety due to uncertainty, not knowing what's going to come next or where to find answers. There's a lot of stress, insecurity, anxiety, and depressive disorder on the rise among youths. It has become a challenge as we need someone to talk to, and that someone may be your parents, peers, teachers, or anyone close to you. So don't feel shy to talk about your feelings.
The COVID-19 pandemic has increased inequalities in human development. While health is complete physical, mental, and social well-being and not merely the absence of disease, mental health is a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively, and make a contribution to the community according to the World Health Organization. Even before COVID-19, mental disorders of varying severity affected 1 in 7 Indians. It adds up to about 200 million or 20 crore people having mental disorders in the country, according to the Global Burden of Diseases, Injuries and Risk Factors Study 2017. Nearly 80% of those suffering from mental disorders do not receive treatment for years, according to the National Mental Health Survey. Mental health disorders are also accompanied by stigma, thereby affecting education and livelihood patterns.
Thank you, fifth semester undergraduate students of the Department of Social Work, St. Edmund's College, Shillong, for organizing a program to observe World Mental Health Day, 10th October 2021, on the theme Mental Health in an Unequal World. The theme calls us to pay equal attention to mental health alongside physical health and to do so in a sustained way. It is indeed an urgent need for us today when a world that is still fighting the COVID-19 and its offshoots of many variants. Now, the main objective of observing this day and the focus of mental health in an unequal world is that all stakeholders who are working on mental health issues, caregivers and family members, advocacy organizations and policymakers are provided an opportunity to talk about their work of giving mental health care to their patients, what they have done so far and what more needs to be done, and to make mental health care a reality for everyone. Their task is indeed a daunting one because mental illness is a much misunderstood problem. Patients with mental illness are often stigmatized, rejected, and discriminated. The society is still ignorant about perceived diagnosis that can lead to most effective treatment in all situations. The scientific researchers are still to find the tools to study what is physically going on in the brain that causes symptoms of mental illness. So mental health workers can only do the best they can with available resources and hope that research will produce better solutions. In such an unequal world, the prayer of St. Edmund's College today is for all mental health workers in our state of Meghalaya, our country, India, and indeed in the whole world.
Recognizable amongst us that mental health is a huge issue which cannot be underestimated. Being educators and being in an educational institution for many years, we've always seen that there is something that is lacking amongst us in identifying the problems faced by the students with regard to the mental issues. As a result, most institutions think in terms of appointing a counselor these days, a full-time counselor. Now this counselor takes care of these sort of issues.
I think as a society, in the Khasi society, we are yet to recognize this as a problem. But it is important now that awareness has been created, that we take this as one of the important health issue. And we also need that different organizations come up, maybe starting from the village level, where they will have people, trained people, counselors to be in the villages to guide different people, especially young people who are facing this mental health issue. As a community, the Khasi community in the past has shown that it is there to assist one another and also to help the people who are in trouble, especially financially, or when they are also in trouble due to unforeseen events such as death in the family or other event that happen, and this has been noticed in the community for long. But with the passing of time, even this is getting away from our society, and especially during this pandemic, a lot of things has happened which we need to take note of, and we need to wake up and to come forward to really take this as one of the important issue that is inflicting our society. I wish this celebration all the best, and I wish that the effort that's being made by the students will go a long way to educate the people who are listening and also to the community at large. Thank you very much.